if a small brain is exposed on screens before 2 years, I think in 7 months, if you take a remene on that brain, children brain, will look like cocaine addiction on adult.
Hello and welcome to a new edition of Connecting the Dots with Sebastian Cochinescu. Today's guest is Georgiana Tănase, a psychotherapist, the owner of Fabrica de Emoții, the Emotions Factory Psychological Clinic, and also podcast.
Have some podcasts.
Great.
On YouTube.
So welcome to this show. Today we're going to be talking about AI, mental well-being, psychotherapy, and ethics. So, welcome. Let's dive into it. First of all, tell me a bit about yourself.
I love psychotherapy, and I started this journey 20 years ago, and more than 20 years ago. And in the last 2 years, I'm focusing on understanding the new direction in psychotherapy. So I start learning about quantum physics and now neuroscience. And this year, I'm starting my doctorate in these studies.
Wow, that sounds amazing. Congrats. So my first topic for today, let's say, it's not so much on technology as it is on mental well-being. We see this concept of digital minimalism and digital overload. And there should be a balance. I mean, these are extremes. Both sides are on one hand, you cannot live without a mobile phone these days or not connected to the internet. And on the other hand, what kids are doing, like doom scrolling and so on, it's definitely not good for your mental well-being. So how do we achieve balance from a psychotherapeutic point of view? And is there any chance on achieving this balance?
In the first place, I think well-being, it's overrated, a status overrated. So I think we should discuss about mental health. It's better because psychotherapy, it's about mental health. And today, a recent study came out in December. So 6 children from 10, they have depression and suicidal thoughts. So I think for creating a balance between a good mental health and using the technology, we should understand which are the points of development in humans. So if a small brain is exposed on screens before 2 years, I think in 7 months, if you take a remene on that brain, children brain, will look like cocaine addiction on adult. So it's not only the brain, it's about a whole body. When this thing with the addiction of screen is starting, it's something very physical because all the neurological system, sensorial system, it's affected.
So how could we prevent that, or how could we overcome this need for doom scrolling? How can we achieve this balance? Are there any tips? Because let's say it's a bit too late when you're 10 or 12, your kids are already hooked.
Now they forbidden phones in smartphones in Australia already and some other countries until 16.
How can you forbid in their own homes? I mean, maybe at school.
No. The
usage of phones.
Yes, because if it's like a surveillance, and if they found it, I think the parents have a big amount of paying for that thing. So it's not you don't have a right to choose here, I think. So I don't know if it's ethic or not, but I think it's healthy for the children. In the same time, if to overcompensate this thing with scrolling, for each hour of scrolling, you have to do 6 hours of sport.
Well, 6 hours of sport, it's a bit too much. No matter, it's great, but I think it's a lot.
Why? You can do it
Well,
if you work outside.
So we're getting to AI now. I think the main advantage of being a human is empathy.
Yes.
And this cannot be faked, at least for now, by AI. And can we teach AI empathy? And then if so, who was the one teaching? And are we replaceable or are we irreplaceable by AI in terms of psychotherapy?
Yes. And in terms of my opinion, okay?
Yeah, sure.
I think we are replaceable. Just look, you have to search and test on AI to ask some questions about depression, about ADHD, anxiety, and a lot of disorders. And if you start putting your problems there, AI, it's answering you with very specific actions of doing day by day to improve your mental health. And it's working. But I think what is missing from AI now, it's asking the feedback every day from the patient and to make a report or status every week. But I think we are replaceable. Look,
that's
let me
scary.
I want to put you a question. Okay, AI, but if you have narcissistic therapist, it's the same thing.
Sure, no, we are not.
It's a lack of empathy. It's the same.
Sure, we are talking about, let's say, a baseline of therapists that are okay and mean well and so on. I don't want to go into therapists that are not okay. However, what can we infer about risks on misdiagnosis? So let's say the AI is telling you, or a chatbot or an LLM is telling you, hey, you should do this and that. And it guides you to the wrong path. And then something bad happens. Who's responsible for that?
Now, no one. And here I have a case that adolescent, I don't remember the age, maybe 14, start using AI bot chat for depression. It's the first time, so I have the card to say that. In our inside schools between therapists, when we discuss about depression or suicidal thoughts, in the end, some of them, they are saying that it's an act of brave to finish. So the same thing did this AI with these children and said to him that
like a challenge.
Yes, like it's better to him if he's doing that.
Okay, who's responsible for that?
No, nothing.
That's a topic that we should somehow address, because if there's a red flag, if there's a misdiagnosis, if there's something bad happens, who's responsible? What should we do? How do we?
In this case, the parents, because it's minor.
Okay, but the parents cannot, even for a child that is underage, cannot oversee everything.
Yes, but look, if in the real world, if client or patient of a psychotherapist is doing the same gesture, when you finish the papers, you cannot say that the psychotherapist it's his
to
fault.
Blame.
Yes,
okay.
To blame. So
the legal guardian is
yes.
Okay, is responsible for that. Because, for instance, you do not have it's forbidden by WhatsApp or for other social media platforms to create an account unless you are 13 years old.
Yes.
And all the 10 years old that I've seen in my kids' school use WhatsApp and other social media apps. And how can you say it's a parent's responsibility when all the other kids have that? It's a huge pressure on the parents too.
Yes, but like legal, all the things that children is doing until 18 is the
responsibility of the parent. Okay.
So I want to discuss here about ethic and about diagnosis. I think AI now, it's making quicker diagnosis and a better diagnosis.
Clinical one.
Yes, the clinical one. Because if it's giving you a test or something, you know the response, they are better scored than a human being.
So on that area.
Yes.
So then
in the
what
clinical
areas,
side.
Okay. And in what areas it's not that good, or you don't see it as a helper?
when we discuss about another type of therapy, in behavior therapy or cognitive behavior therapy or schema therapy, AI is very good. And in the therapy, when the client is learning something, AI is the best. But when we discuss about soul, spirit, and hugging in therapy, AI.
Yeah, it's irreplaceable for now. At least till we have some robots that you can hug.
But I think 6 years ago, when I want to go to a project in France, they start doing AI therapist already, and now it's functional. It's looking like me or my colleague. It's
Wow.
very creepy.
That's creepy. So we just touched a bit on children, psychotherapy, or issues with devices, doom scrolling, and so on, and access to social media. And I was wondering, how can you, and that's something that I struggle with personally, how do you manage the screen time in kids' formative years when they're young? There's a peer pressure on one hand from their colleagues, and on the other hand, it's giving the kids dopamine a lot easier, faster, and in large amounts than other activities. So how can a parent manage or compete?
If you think to start managing that thing, you're starting with detox. So 1 month without phone. And then you start putting hours, but it's about what you choose, because will be a lot of differences between your child and the other one from the school about homeworks that they give on the WhatsApp or something like that. So it's about how much are you want to spend your time with children and how much you want to invest in that time. Because if you take the phone, you have to ask yourself, do I have time to ask the professor every day which one is the thing, what I have to work with them?
So it's actually the responsibility of the parent again.
Yes.
And I remember in the early 2000s, 2010, when gadgets were more and more present, some parents saw this as actually a helper because they can just get rid of the kids and focus on some work or just
the reality, it's the same now. If you have a lot of work, you give the phone or the tablet or you put on the screen and it's quiet in the house and you have time. I can give you an example from my children. They have access on devices in weekends, only in weekends. And I'm so sorry for my teenager, but he has time screen 1 hour per day.
Mm-hmm.
And I'm not giving, after 16 years, they will have the old program. But now 1 hour per day. And the phone is closing.
And how are you managing peer pressure from his colleagues that are all on other apps?
I have to speak nicely.
How are you managing it?
I'm not interested.
Okay, you're not interested.
Yes.
Then,
so
yeah, that's tough. So
you have
that's
to
the
choose.
only position that
you have to choose what you want. So for me, it's better. I explained to him many times that I know he's upset on me, but I don't have, in my opinion, I'm working with addiction of video gaming and screens. I don't know if you went in the hospital in Obreja here in Bucharest to see that they have one section where there are teenagers there with social media addiction,
mm-hmm.
and they take medicine and their mental health, it's very bad, and it's worse than the drugs, the substance.
So what's the solution to this besides being a very severe parent or strict? Is there a way, let's say, to sugarcoat it?
And I don't think so,
ground?
Because children doesn't have the to think on himself, on to make a priority on his life. It's not, they don't have consciousness of being good with himself. So for them, it's better what they have now in their hands.
They live in the moment. And
Yes.
that's a good thing, to live in the moment,
Yes.
however, not on your phone. So you mentioned social media and social comparisons and being perfect online. And that's not only regarding children, it's also for adults. Authenticity, fake authenticity versus self-expression, like genuine self-expression. We seem to have, or we've seen people that seem to be happy online or live very fancy lives, and you know them and you know for sure that they're pretty messed up in real life. How are we managing this, or from a psychotherapeutic point of view, how can this again get to a balance instead of focusing on your online behavior or your online image?
I think the first question is about why we start focusing on showing the others something.
For validation, probably, right?
Yes.
Okay.
Yes. And it's like operational learning when you start showing something on social media and you receive like. So when you have a lot of, hearts or like something like that, you start creating in your mind profile that it's like a people pleaser.
Mm-hmm. It's a persona. It's a different persona.
So if you want to say it's like an alter ego. So I'm here at my home and here it's the person that I put on the screens.
Mm-hmm. So how do we overcome that? I mean, there are some triggers and there's maybe a way to build resilience against that.
In first place, you have to make a lot of friends or
in real life.
Group. Yes.
Okay.
A group of friends.
But if friends are again online, if most are spending their time online, how can you
to make the half time online, half time in the real life? Because you can go and play board games at home, to go out for dancing, clubbing, walking, go on the mountains, something like this.
Well, that sounds like, if I have to quote my daughter, boomer activities. So how can we at least make these kind of activities seem more attractive to digital natives? Again, we're going to a lower age. This seems like an unfair competition.
Yes, but look, in my boot camps, I have children and adolescents also. Mm-hmm. So they are not allowed with the phone, only to speak with the parents in the afternoon. In the first 2 days, they are very upset on me. They're crying, they will want at home, something like this. But after 2 days, they start seeing the world around them. They start speaking, they start observing, they start feeling. So if you want to, make a relationship or rebuild a relationship with a teenager or boomer, you have to take him or take her sometimes to stay, 1 or 2 days at least
2 days
somewhere without phone, without screening, because it's not they like the life, but they don't know how the life is looking without this.
Well, that sounds tough to implement, because I can't really recall the last day, 24 hours connected, that I've spent without my phone, and I'm an adult. How about a child? That seems impossible nowadays.
No, it's not impossible. It's just for the first time. It's hard. Mm-hmm. But then it's
like a detox.
Yes. If you do it recurrent, it's okay.
So let's go back a bit to AI. So if machines cannot feel, at least for now, we haven't got to AGI yet.
Yes, but they don't feel. But when they writing you the answers, they learn how to express. So the human being is understanding that they're feeling it.
Yeah, but it's still fake care.
Yes, but
machines cannot care because they don't know how to.
Yes.
They know how to emulate.
But you are speaking that with a normal person. When you are discussing with a person that is having mental health problems, real mental health problems, every good sentences or words, they understand.
Triggers or things to attach to.
Yes.
But that's dangerous. Isn't it dangerous from an
Yes.
ethical standpoint?
I had some patients that they said they drop out the therapy because they discuss, so it's more easier. They don't have to pay money with the chatbot from AI. And they come back after 6 months.
And do you see some improvements, or do you see
No, they start taking drugs.
Well, I think that kind of answers our question, because without a proper guidance and expertise of a human being for now, it's almost impossible to rely only on a chatbot to give you advice on mental health. But I'm pretty sure that the problem, the underlying problem, is about empathy, not only about expertise, because large language models right now have data to feed on to provide some sort of answers to some questions, but cannot emulate empathy. So
yes, but they can emulate on the human beings right now, because in the last, I don't know, from the pandemic, the level of empathy drop out, so it's not okay.
So people drop out from
on empathy, yes.
And we become sociopaths because of what?
Because we need to work a lot. We need to, seems that we look good. We are perfect. This pressure on the parents that you have to be the perfect parent, to learn about parenting tools, to know to put the rules, to not hit the children, to not yell at the children. So you have to be perfect on your job, in your relationship. So I think when you start being perfect, you start losing your sense of reality and your empathy.
Yeah, and when you start to want to become perfect, because obviously nobody is
just
perfect.
Cognitive, you start learning some behaviors and you're acting, but you're not acting like you're authentic.
Authenticity, right. So you've been through the whole pandemic situation as a psychotherapist.
Yes.
And you've seen the movement from face-to-face, in-person interviews and discussions and therapy sessions to online.
Yes.
And Zoom and other platforms, video online platforms. How difficult was then? How easy it is today? Is there a difference still between in-person meetings and online meetings from the point of view of psychotherapists?
I think in the first year in the first 6 months was a little bit difficult because not everybody was used with technology. So also the therapist. But in the first 6 months, we start adapting all our technique for using online. And we put the client, the patient, to buy some stuff at home that they were like a blanket. So when they need a hug from my side, they put a blanket and they put it very hard on that. So it's a little bit look like a hug from my part, or a very small doll or a pet, something like that, to use for in different techniques.
Emotional support. Yes. Okay. And how about today? How is it today?
Today
it's something have conversations and sessions online or in person?
I think from the last 6-8 months, they start coming in the office again. They are saying that they don't want online anymore. And I have some patients that they're refusing online sessions.
And why do you think is that?
Because they start feeling alone. So
then we come back to what we discussed earlier. It's kind of irreplaceable, some human connection or empathy or care.
The real human connection cannot be replaced.
For now.
For now.
Because if you take into account the new glasses, VR, AR glasses.
I have VR on my clinic, but I use the VR session just for a specific phobia, like airplane phobia, animals, and tall places, something like that.
I use the Apple device, the VR glasses, and it's mind-blowing because the reality is constructed again through some video cameras on the glasses and can be altered.
Yes, but if you are start using VR more than 6 minutes or 12 minutes per hour, your sensorial nervous system it's affected and your vestibular system, you don't have balance to walk when you finish the session and you start feeling dizzy. And your sensorial system cannot understand the world, because in VR sessions your sensorial system is overstimulated. So
if we are talking about a game or something like that, how about a therapy session in metaverse using VR glasses?
It's not possible right now because the human body is not supporting that.
Okay, you should have some sort of
yes
model in front of you.
Yes, and you can a human body can support 6 minutes until 12, but it's too much.
And then it's
and then your brain it's shut down.
Okay.
So I think we have to develop more our brain function and using more our body or extra abilities that we have.
So I know that you are into biohacking and neurofeedback and all this sort of edge.
Biohacking is the best word.
Technologies. Can you tell me a bit about that? How does neurofeedback comes into play with standard, let's say, psychotherapy?
Neurofeedback that I have now, it's neurooptimal, and it's about biohacking.
Okay.
It's not a neurofeedback in full description.
Can we describe just a second what neurofeedback means and what is it for?
Yes, it's a process when your brain is receiving some stimuli and you have some sensor on your brain and it's measuring your feedback and your electrical neural circuits. So when you start receiving in this soft or device neurofeedback with the electroquantic impulse, it's sending some electric impulse in your brain and you start regenerating your brain, but in different areas. What I have, it's with binaural music. So when you listen music in the soft, you start using your brain more than normally, like 40%.
Is there a limit of 6 to 12 minutes?
No, because
it seems a bit similar to VR and to some sort of
because your eyes, you should close your eyes and relax and just only listen to music. And from the sensors, you're not receiving nothing, any electric impulse in your
So it's
head.
only measuring.
It's just only measuring, and the music, it's restarting your brain.
Okay, so it's not intrusive.
No.
Okay.
But the other one, I know that they're saying they're non-invasive and something like that. It's not really, in my opinion, it's not true.
Okay.
Because a therapist...
What do you mean by the other one? There are different types of devices.
It's called, the first one is IFL. So it's low frequency. When you have low electric impulse in your brain. So the therapist, it's setting how much electric impulse it's giving to your brain. But if the therapist, if it's a little bit wrong and changing only 1%, yes, your brain will be shut down.
So how about for anxiety or ADHD? How does neurofeedback works? Are there some results? What's your personal experience with that?
With my device, after 3 sessions, they start sleeping. They start having a good sleep in the night, and they start controlling their impulse. They start focusing from 10 minutes with 20, and then 25. And after 20 sessions, they start focusing from 35 minutes to 45 minutes. So the results are very good. But I have more difficult cases with sclerosis, which they have half of the body paralyzed. And after, I think, 4th session, and the patient took interferon also. They start feeling their body, and after 10 session, they're walking, driving like a normal
Sounds
person.
like a miracle.
It's not a miracle. It's about frequency of the body. And here I start learning about quantum physics.
Well, is this measurable? Is this
Yes.
scientifically backed?
And
Proven?
the studies are from, I don't know, from the 20s. So Rudolf Steinert was the first that was studying about body frequency and about healing. And if you start reading all studies of him, you can see that in one of the books, he draw how will look like healing the body and how will look like a system. And when I opened my screen on my soft, is the same drawing with the same colors. So I think they have 100 years ago.
That's interesting. So on the future a bit now. So in the near future, AI will be more and more integrated into our lives, maybe even brain-machine interfaces like neurofeedback.
Yes, and also the medicine and the therapy will look different.
Exactly. So I was wondering, how do you think it will impact human relationships and therapy? AI, how do maybe technology will impact therapy and human relationships?
I think we have to learn how to use AI and technology in our professional way and in our good and not destroying us. If we start creating a relationship with the AI, I think we can use it in our behalf in therapy. If not, AI will start replacing us. So you can use AI or a machine or a bot for diagnosis, for clinical diagnosis, to see if the patient has, I don't know, different disease, mental disease. If not, they will go to all of the kind therapy. If not, they will have a psychiatrist and another specialist. So I think this is the way to using in our behalf.
As a helper.
Yes.
Okay, so you're, let's say, pro AI, pro technology as a professional, as a psychology professional.
If you are using technology, you can adapt every day. Also in your job and also with the new generation. You know that my team from the group therapy, they make my TikTok account and my Instagram account, I don't know, 2-3 years ago. And they said, Georgiana, if you don't have Instagram account, you're not existing.
For their generation at least.
Yes. So, okay, make an Instagram account.
Yeah, that's interesting. So how about human relationships? How do you think they will be affected by AI and technology? Are we becoming lonelier or more connected? Are we more connected or are we not?
No, we are not more connected. We are lonelier, but I think we have to make a choose here. It's if you want to have friends, you have to do something. If you want to just to lay down and waiting, I think that humankind will be split in two.
Okay.
The person that they will keep the emotional connection with the others and will be stronger using technology in their own good. And the other one that they will use technology to just to survive. Because just look at the children when they start playing games. Let them to play games 2 days, 48 hours.
Without any device?
No, to play games.
Okay.
Video games.
Video games. Okay.
48 hours. After 48 hours, you'll see that they don't distinguish the reality from the video game. So if you start playing every day video games, the video games your reality. The brain doesn't understand anymore. So we'll have your life, but there with your avatar, not in real life.
Yeah, that sounds dangerous. And I don't know.
There are a lot of
things. Can we do about this? Is there something that you can do about this or for this whole generation that seems to be somehow immersed into digital worlds and metaverse and not so much into their real lives?
Sincere, I don't know if we can help them without parents helping them. I think I'm sorry for the parents, but they have
It seems to be like this. We have some issues as civilization, if you
Yes.
want, because of technology,
Yes.
because we are more and more focused on our devices and doom scrolling and so on. And it seems also that we're going to fix this, or at least attempt to, by using technology that will help us get rid of technology. That sounds a bit weird, but I think that's where we are right now.
Look, try to not use your telephone one day.
Okay,
I will tell you what you'll start
interesting.
feeling. A lot of anxiety.
Mm-hmm,
You will start feeling a lot of anxiety because your mind will say to you, I will miss something.
Fear of missing out.
Yes.
Right. So just two things before we conclude our meeting today. In the age of ChatGPT and of chatbots, is chatbot complementary to your profession or a competitor? How do you see it? You said that you had some clients that gave up therapy just to go talk to a chatbot and came back after 6 months. How do you see it? Is it a competitor? Is it complementary to your job? How can it be used maybe by you or some of your colleagues as a tool, not as a threat?
In my opinion, I'm using ChatGPT like a tool.
Okay, but for
researching and learning. For my job, yes.
Not for social media and...
No, because if it's some study it's releasing now, I have to pay something and on that, professional site or something.
Mm-hmm.
But if I put on ChatGPT, they give me the result of the study without paying anything.
But sometimes ChatGPT is hallucinating and they're not really giving you a good... Let's say, and now I'm the devil's advocate. How are you cross-checking that, cross-referencing? I mean, what I'm trying to say here is that we may be at risk of over-relying maybe on some data that it's not really true. For instance, we are doing an Animaphilics transcriptions.
Mm-hmm.
And at some point, a couple of years ago, transcriptions with Whisper in OpenAI were known to be hallucinating. And that's a problem.
Yes.
If you rely on that.
Now I didn't had some problems with that. So
with what's available today, yes, it's okay.
They are doing some mistakes, but very small mistakes in words or describe something. But if you are a professional and using it for your job, you understanding where is the misunderstanding.
Mm-hmm.
But I think it's still very good, accurate data now.
I've had an interesting conversation with a friend that's a lawyer, with a lawyer friend, and they said, okay, for contracts, ChatGPT is great because for standard contracts, when everything goes well, might be okay. However, when problems arise, then ChatGPT will not be able to help you anymore. First of all, because of liability. It's not actually assuming any kind of liability. And second of all, there are so many fringe and edge cases that cannot be covered by a large language model.
Yes, but someone learn me how to use ChatGPT.
Mm-hmm.
You have to put in description your country, your city, which are the problems.
Yes. So context. Okay.
But if you put that, the contract is very good. I think sometimes it's
better than a lawyer.
Yes.
Okay, so let's close this by asking you for some books, or maybe a book that you recently read or that you would recommend reading. Is there something or maybe a study, or maybe some sort of, besides your podcast, where can we find something interesting to learn from?
From people understanding easily, I think Noah Harari, it's a good author to read all the books of him, starting with Homo Sapient. It's a very good book, and it's discussing about AI and what
before
happened.
ChatGPT.
Yes, and another books they're about Rudolf Steiner, about
you
what
mentioned it.
Yes, it's having I think 6 or 8 books like this, but if you're passionate and you want to read about and understand about neuroscience, how to heal your body with frequency, I think this is a very good author also, and neuroscience also.
The latest book that I've read on this is The Anxious Generation, and I highly recommend you that book. It's quite interesting on these generations that grew up half with computers, half without, and now the actually digital generation that is having the problems created by technology and trying to solve it with technology. So that's quite interesting. So thank you, Georgiana, for being here today, and it's been amazing talking to you. And I will dig deeper into what neurofeedback means. Thanks again for
Thank you
for
also.
being here
I
today.
hope that our discussion will help a lot of people and
Same.
will understand what we said.
Thank you.
Thank you.